In the early years of the Obama administration, there was this rumor going around conservative spheres of the internet that Obama was giving away free cell phones to poor people. Conservatives called it the ObamaPhone program, and it became this whole shorthand for an administration that favored one group of people over another. Fact checkers debunked this program over and over. But in a sense, the ObamaPhone program existed, and it helped stop an outbreak of Ebola in the United States. I asked Klain, the White House's Ebola czar, to explain what happened.
We made a decision to keep air travel open to West Africa. And that decision was a very important decision for fighting the epidemic. There was simply no way to muster enough private airlift to move the people, the equipment, all the things you needed at an affordable price. And so having commercial air travel both ways was very important. If you're going to have commercial air travel, that means you're going to have people coming from West Africa. They didn't come directly, they came through Europe, whatever, but you had people coming. And so those people might have Ebola. We knew the odds were low that any number of them would, but it was possible. Our major goal on the inbound travel was to make sure that we didn't let Americans get infected by exposure in the United States. Most of the people who were coming from West Africa were coming to see family, and immigrants from those three countries tend to cluster in a few places in our country. The Acela corridor, essentially from Washington up to Boston, in the city of Atlanta and in the city of Minneapolis. The problem with Ebola is that you can be exposed on day one and you're not really sick till day 7 or 8 or 9 or 10, roughly. And so the point is taking the temperatures pulls off the people who are sick, good, but still there could be people getting on the plane who might turn out to be sick a week or two later. So you need some system, some process when those people arrive to make sure that 7, 8, 9 days later they aren't getting sick. Their symptoms aren't finally manifesting. We had to build a system to quickly identify who had come from West Africa, who might be sick, and get them into isolation and treatment before they could infect anyone else. We were able to identify anyone whose trip had begun in West Africa, no matter where they had gone in the interim, and landed in the United States. So we knew that from the plane records. And we made a decision early on to simplify this by requiring all those travelers to land at one of 5 U.S. airports. So if they tried to book a trip to some other airport, their trip wouldn't get booked or would get canceled, and they get rerouted to one of 5 airports. And our goal was to build screening facilities at those 5 airports that would use the manifests from Homeland Security to say, we expect Joe Smith to get off the plane, his trip started in Liberia, and we will identify him as he comes through customs and take additional measures to screen him. And then we would get his contact information and follow up. And the idea was we'd ask him where he was going. Was he staying in that city, going someplace else? We'd get his contact information, his phone number, his email, all these things, and we'd pass it on to the public health officials in that locality of his final destination. And those public health officials would call the person twice a day and get their temperature reading. And we were quite confident that if we could get someone clearly before they had a temperature, even when their temperature was just starting to get up, we would quickly get them to the hospital. They wouldn't infect anyone else. And so there were just probably about 20% of the people who we would call and not be able to reach them, not be able to get their temperature reading. Tom Fried, the folks at CDC and others involved said, look, you know, we can get very, very inexpensive cell phones, what they call in the parlance burner phones, cheap phones you buy, you use them for 30 days, you throw them away. They're used often by drug dealers, unfortunately, but they're very inexpensive phones and designed for temporary use. And we focused on this and realized that what you could do was you could take this manifest that we're getting from Homeland Security, match people with a cell phone number that you were going to hand them, and send that to the state public health officials before the person landed. So even before the person arrived in the United States, if their final destination was Indiana or Ohio, the Indiana Department of Public Health would know that the next day Joe Smith was showing up, and here was the cell phone number they'd have. It was a very tight, nice program to make sure that we could find those people, we could call them, and we had no errors in the phone numbers, all handled electronically, all very state-of-the-art, all very buttoned down. The CDC Foundation came up with the money to purchase these phones. So it was private funds, no taxpayer money. Early on in the Obama administration, President Obama had a program of trying to help people connect to the internet. People who were not connected, to try to close the digital divide. And one aspect of that had been a program that allowed low-income people to get help paying for their cell phone. And so they could be connected to the internet, so they could be part of the modern world. Right-wing critics kind of called the thing like food stamps for iPhones, and famously called them ObamaPhones, and derided the ObamaPhone program, even though it actually was a program that had bipartisan support in the past, as something kind of had started really under President Bush, but nonetheless it got this derisive name, and there was this stigma around the idea of the president handing out phones to poor people. And so when we had this idea that the best way to keep the American people safe was to do this pre-programmed cell phone concept, immediately it dawned on me that we might well be politically ridiculed, that this would be like our global Obama phone program. When we finally cooked up this plan to do the phones, I talked to Tom Fried and I said, look, there is this political thing about the Obama phones out there. We owe it to the president to go brief him on the plan and make sure he's comfortable with it as a political matter. So we went into the Oval Office, kind of laid out this whole thing for the president. And he said, well, it sounds sensible. It sounds like I could keep people safe. What's the issue? Like, you guys have a great plan. I said, well, Mr. President, you need to understand that we will be giving away free cell phones to foreign people. And your critics will say, it's ObamaPhones international. It's ObamaPhones gone global. And he looked at me and he just laughed. And he said, look, your job is to keep the American people safe from Ebola. My job is to take the heat. You go do this. It's going to save lives. It's going to keep us safe. I'm not worried about the Obama phone attack. In retrospect, the phones worked incredibly well. It was a very inexpensive, very effective system that protected the American people from the risk of Ebola and allowed the response to go forward with travel to and from West Africa.